Hi, my name is Tanya Marie, and I'm a colon hydrotherapist at the Natural Medicine and Detox Center. And I'd just like to tell you a little bit about myself and then like to discuss 10 of the most frequently asked questions that clients have when they come here. So the first thing I'd like to say is I started in 2006 was when I first started. So this is 2016, so it's been about 10 years. And I started in California, and now I'm in Arizona. And I've been trained on the open system, which probably doesn't make sense to a lot of people, and the open and the closed system. And I'll be discussing a little bit about both later and make that a little more clear. So I started in 2006, and I have a kind of amusing story about that. My sister got me into it because I've always been into health, and I've always liked to research things on health, and I always liked I did cleanses and different diet things, and I was always experimenting on myself and family members. So my sister Lisa, I would show her how to use enemas, okay, because you can do that with your siblings. And so she mentioned that to a colon hydrotherapist that she went to frequently, and she said, wow, she'd make a great therapist. So that's how I started. I said, oh, okay, I can try that. And I've been very, very happy with helping people to improve their health and take back their own ability to reset, so to speak, their system and help their body heal itself or bolster their immune system. So one of the frequently asked questions by clients, especially first-time people, is, does it hurt? And the answer is, it does not hurt. It can be uncomfortable the first time. And the reason for that is just for anything that you have not done before that is strange to you. But I would like to show, like for example, one of the speculums for the open system. And this may look a little daunting at first, but if you notice right here, it only inserts this far. Your natural muscles in your body would prevent it from going that far. So, and the thing that's interesting is that most people, they say, oh, I'm a little, I'm uncomfortable. And once they have begun the process, the common question is it in? And it is in, and it is comfortable, and it works to help hydrate your body. So that's one of the questions. This is for the open system. The other speculum, this is for the closed system. It's a little more difficult to really see what is going on here, but the speculum is this white object in the middle here, and that does insert a little farther than the open system, but it is both speculums are lubricated, and it actually is quite comfortable, and you will not experience pain or things like what people make up in their minds that they may experience. Another frequently asked question by clients is, how many do I have to do? And that's a very subjective question because each person is different. What you have to keep in mind is that like I said, every person is different, and it's determined by the goals that you want to achieve. Most people think that they can just undo years and years of constipation and unhealthy habits and diet with one colonic. That is not the case. Usually you need to do a series of colonics, and here we recommend at least 3 to begin to hydrate your system, to get the muscles, the peristaltic muscles in your colon to begin to respond and function normally. So, like I said, it varies. You could do 3. For myself, my doctor recommended that I do a series of 12, and I would recommend to most people to do 12 or 15 within a year to get their system regular, and then do 1 for maintenance like every month or every couple of months, or if you're doing a cleanse, or it depends, like I said, it depends on what you're doing as to how many you should do. But the point that I want you to take away is you won't be able to undo 10 or 15 years of constipation and bad eating habits in one colonic. Another frequently asked question is, can I lose weight? Most people want to know if they can lose weight by colonics. So what I would say to that is, again, it depends on the person. You will definitely lose something during the process, but you have to look at what your goals are. Diet and exercise, of course, are the best ways to lose weight. The colonics is another tool that can help you with that because it's helping you to release waste that's impacted the body. Most doctors say that we're all walking around with at least 10 to 20 pounds of impacted fecal matter in the colon. So when you look at that, it kind of affects what you want to do. You might want to think like, okay, if I put this together with diet and exercise, perhaps it can help me reach my goals that much quicker. One question that I get that I really, really love is when a person says, what is the difference really between colonics and an enema? Why can't I just clean my colon with an enema? Well, one of the reasons for that is you have to consider what a colonic does and what an enema does. An enema, for example, I'm going to point to this chart right here. An enema only irrigates colon, and that is like at its best 7 inches. Your entire large intestine is 6 feet. And so it's not going to get that far. It's not going to do as much good as you would like for it to do. And a colonic, on the other hand, can irrigate the entire large intestine. So you can see that that would be more beneficial to you over the long run to just do the colonics. Another favorite question that clients ask is when I say, how many bowel movements do you have per day? And most people say, oh, I have a bowel movement every day, so I should be good, right? Well, the objective for your digestive system, if it's functioning properly all on its own, you should have a regular bowel movement 40 minutes after every meal, so that if you eat 3 times a day, then you should have 3 bowel movements. And then the question becomes, because some people say, oh, I go to the bathroom 2 or 3 times a day. Then the question is, what type of release are you having? Most people vacate the rectum, which again, as I said, is 7 inches. So if that's your bowel movement, it is an incomplete bowel movement. A complete bowel movement contains the rectum and the sigmoid, which is another 16 inches. So if you void that 3 times a day, you may consider yourself not constipated. Another question that clients frequently ask is, how long does the session last? So typically the session is 40 minutes in and of itself. If it's your first time, however, it's going to be a little longer. You have to do your paperwork, and we may need to explain or answer some of your questions at that time. So you want to set aside a little extra time for that. And afterwards, you may need to go return to the restroom. So you want to figure all that in. So 40 minutes for the session and the other things, it may make sure you've at least set out an hour for your day. Another question, what should I do to prepare? Clients want to know, what should I do beforehand? Well, it's really a good idea to make sure you're fully hydrated. So most, like a rule of thumb, some doctors say that you should take your weight in ounces. Divide your weight in half and drink that in ounces. So if you weigh 150 pounds, that's 75 ounces of water you should drink each day. So you want to make sure you're hydrated, like maybe 2 or 3 days up to that session. Make sure you're drinking plenty of water. It'll just make your session a lot easier and more productive. Another thing that you may want to do is make sure you've eaten vegetables. You've eaten healthy foods. You might want to slack off a little bit on bread, pasta, rice, things like that that have a tendency to complicate your system. It might like slow things down a little bit, so you might want to avoid those types of foods. Another thing you may want to do is drink some fresh juices, just kind of like take it easy on meats and things like that. Another question that clients have is, can I eat after a colonic? What should I eat after I've completed my session? So what you definitely can eat, you want to kind of go light, because during the session you have definitely released a lot of material, and you want to give your system time to readjust. The muscles of the colon have been stimulated, so you kind of want to go easy. We usually say things like soup and salad, and just relax, and of course drink water. Another question that clients have frequently asked is, will I be able to have a bowel movement after a session? And that's really a good question, because during the session, you can actually pass a lot. So you have to also consider that you may not, it's not unusual if you don't have a bowel movement for even a couple of days afterwards, or you may go to the bathroom right away because you've stimulated your muscles, and because they've gotten a little out of practice. That's one of the things that happens when you're constipated. You don't go a lot. The muscles aren't used to contracting 3 or 4 times a day. So you have to consider that after a session. You may not, or you may. So it's just, the basic rule of thumb is, don't worry. Everything's going to be fine. Another frequently asked question by clients is, what exactly is the difference between the open and the closed system? Well, there are a lot of differences, but we'll focus on 2, the speculum and the individual experience of the client. So here we have, this is the speculum for the closed system, and this is the speculum for the open system. So you can see right away there is a huge difference in between the 2. And the reason why this is called the closed is because the 2 tubes and the speculum all merge together, and it is a closed system where the water flows in and out through this device completely. And with the open, you can see there's only one piece, and this is the part that is inserted, and the water flows through the speculum and the material flows out around it, which is why it's referred to as open. Experience-wise, with the closed system, the therapist has to stay at the table throughout the entire session, and it is advisable for them to hold the speculum and make sure that it remains in place securely during the session. With the open, the way it's set up, you can't see this from here, but the way it's set up, the therapist has more autonomy, and so they are able to move around. They can be more thorough with a massage of the colon area for the client. Another advantage is that the therapist can leave the room once they're comfortable that the client will be fine. You can have privacy, which is something that's important to male clients, for example, to have some privacy during the session. That's basically the difference between the 2.